Howdy, I'm just getting back into bed. I have Cleo here, and we're working on part 1 of her daily therapy. And that is what we call the heat therapy. She's on day 6 of the surgery. Tomorrow is the day is a week from when she actually had the surgery. 2 days ago we started her physical therapy. Cruciate repairs in dogs are just like humans. They have the same amount of stuff. A lot of physical therapy to make it actually successful. You can have it done and not do all this stuff, but if you do this stuff, it will make it a very successful treatment. And for how much cruciate repairs cost on dogs, it is a good idea to follow your vet and your surgeon's instructions. So what we're doing is my surgeon suggests warm, damp heat for 5 to 10 minutes before her exercises. And I have a heating pad so that it's a steady heat. It is set on low. Wrapped around the heating pad is a damp cloth. I change each time we do it. And you do that for 5 to 10 minutes prior. And if you see, this is one of my favorite surgical recovery things. It is actually an Elizabethan collar made by Jorvet, and it's not a giant cone, but she still cannot reach her back leg. So I love these. I love these. I love these. My vet actually turned me on to it 2 years ago, and it's the coolest thing on the planet. They can lay comfortably, they can eat, they can drink, but that's what this is here. She's right here. This is her noggin. This is her rump. And what we're going to do now, that we've hit about 10 minutes, is her range of motion exercises. We have to do this every day until we get x-rays. And what we're going to look for on x-rays is the forming of bony calluses. So until we get the x-rays, this is the one therapy that we do every day. And I'm just going to turn this off so I don't start any fires. You can see it's underneath. This is her leg. And on top. And I use a white. I'm actually using old white pillowcases, and I use a clean one each time. What I'm doing is I'm using white so I can check to see if when it's warm and hot, if it's drying out anything from the wound. It helps me keep a little better eye on the infection because I'm trying to keep her pants on. And the other thing is, I check her pants every time I take them off. And I see nothing. They're nice and clean. So what we're going to do is, this is going to mimic a walk. And we're going to do 20 reps of this, and that's it. 20 reps, very slow. And what we're going to do is we're going to lift her leg. And actually, I'm going to grab this white thing. It's healing, it looks wonderful, it looks nice and healthy, but I really don't like to accidentally directly touch the wound. If I put her leg on my hand with this on there, I think it'll be a little gentler on her than my hand. So what we're going to do is we slowly bend her leg back and bend it forward. Just like walking. It's to exercise the stifle, or the joint in the knee, and get the muscles working again. She had a full tear of her cruciate, which basically means she did not have the muscle at all, holding her leg together. And we do 20 reps of this, and despite how crazy and happy she's been lately, this is definitely a little bit of an annoyance for her. And you keep an eye to go nice and slow. You don't push any more. I notice I have a lot more range of motion coming forward. If she starts to pull back, I let her. I don't fight with her on this. Coming forward, straightening out, she has more than going back. So I'm just trying to go very slowly and hope that everything works. She has stitches inside and about 25 or so staples. I'll know for sure when we count them when we get them out. Baby, it's okay. So that's right about 20, and she usually can count better than I can. So what I'm going to do next is I'm going to take the damp away. Check. I see no seepage. And I'm keeping a constant eye on that because seepage, anything coming out of the wound, will be the first indication that there's an infection present or she's rejecting something, because they do also put a metal plate in there. What these are little girl's pants. And I got the idea when my dog had mast cell, my other dog Caesar had mast cell surgery. And basically what I do is cut them in half for her. She needs to wear, I keep them on her at all times so that the boys don't mess with her, so that it's harder for her to get at it. It's wet, it's muddy, it's rainy, it's cold, it's October in Wisconsin. So I'm just doing this as an added barrier to help keep that wound area clear, because there is no bandage and it was a very major surgery. So basically this would be a little girl's pants, girl's size 2T for anyone interested. And I cut along the seam in the center, and I just cut the whole half off. I only need one leg for her. Now, she has a very tiny waist, so I also had to cut the waistband so that I can actually tie it. And since she's a short little pit bull, I cut down here just to match the length of her legs. So it comes down to about her ankle. Ooh. Now, she had a little bit of edema, and after we do the exercises, I'm just going to give her a little bit of a massage on her ankle to get the rest of that out. That's a common thing that happens after surgery. The swelling, it causes basically water retention. And hers is almost completely gone at this point. So that is definitely good. That was something that I did expect. And you can expect with any major surgery in a joint, a leg. I'm pretty sure Caesar had it when he had his mast cell removed from the back of his leg. And it's just gentle massaging will help get it out, keeping them off their feet, which she has proven to be excessively challenging. So now I'm going to put this on, because the next part of this is her cool therapy. Just like an athlete, she gets her warm-up and her cool down. So I'm basically just using this to cover the leg right now. And once we get her up and off the bed, I will put it on properly and tie it up, cinch it around her waist for the next 5 to 10 minutes. What I'm going to do is just slowly move. And this is a gel pack. Peas work great. Corn works great. The reason those work so good, like the gel packs, is that they're flexible. They are not hard and firm. And all I'm going to do is slowly just rub this around. I'm not going to leave it sitting in any one position for too long. The cold just kind of gets in the bone, and she now has a metal plate in her leg. So I am going to keep it moving so that it doesn't hit on that one spot, set off any nerves, set off any excessive pain. And this is what I'll do for the next 5 to 10 minutes. But this is what we do every day with Cleo. And our next step will be short walks. But this is the initial and very first physical therapy that you do with the dog that has had a cruciate. What I'm going to do is just set this down to the side, hold her down so she doesn't get up while I turn you off. Thanks for joining us.